It's been so inspiring this year to watch as a pediatrician everything that my patients' parents have done to try to get them through this year, to try to navigate doing homeschool, to try to give their kids all the support they can while they've been struggling financially often themselves. La Clinica has sites across 3 counties. We serve a really diverse population in each site. Here at Transit Village in Fruitvale, we serve a really big immigrant community. Most of our patients are Spanish speakers from Mexico and from Latin America. From the very beginning of the pandemic, it became clear very quickly that our patients were being disproportionately affected by COVID.
So for a while during the pandemic, this particular zip code of 94601, which is the Fruitvale district in Oakland, did have the highest rate of COVID-19 infections in the Bay Area, which is never a distinction that you want to have.
So many people lost family members and friends during this time, and we just continue to keep our doors open. We continue to make testing available.
It's really heart-wrenching to hear all of these stories and feel like, you're trying to do your best to help them. With our testing and contact tracing, I'm really proud of the work that La Clinica has done in terms of how many people we were able to test throughout the pandemic. We've tested tens of thousands of people, probably about half of which were La Clinica patients, and the other half was just anyone in the community who needed a test.
We're really proud of our vaccination program. As an organization, we've given almost 40,000 vaccines in the past few months.
We've just devoted every possible resource, pulling medical assistants and nurses and physicians at times from the clinics in order to get them out at our vaccine sites so that we could get as many shots into arms as possible.
So I think as we work towards a path to recovery, there is a population that still hasn't been vaccinated that we're going to try really hard to reach. I think over time we'll be pivoting from doing big mass vaccination clinics where we might vaccinate 400 or 500 people per day to doing smaller outreach events where we'll be going more into neighborhoods, to grocery stores, to housing communities to make it as easy as possible to get vaccinated.
¿Qué tal? ¿Cómo estás?
Bien, ¿y usted cómo está?
We're the front line of defense in a global pandemic. But I think another really important role that we play is just being there in support of our communities and not just treating them for COVID-19 infections or screening and testing for COVID-19 infections, but also taking care of that whole person in all the other ways that they're impacted economically, mental health-wise, academically for kids, and just finding all the ways that we can really support that whole family and all aspects of their life during a pandemic.